Once the law probably gets amended is when we expect the Department of Labor will start working on their minimum standards. The statute itself says that the minimum standards must include at least the following things. And I will let you know right now that you are now seeing the first of 3 slides listing required components of these standards as we work through it. And I won't read um, every word on these slides, but you will quickly start to recognize these components. Employee health screenings, face coverings, PPE, protective clothing, respiratory devices, protective shields, barriers, hand hygiene stations, regular cleaning and disinfecting of shared equipment, social distancing for employees, consumers, and customers, compliance, isolation, and quarantine orders, engineering controls, ventilation, designation of a supervisory employee to enforce compliance, the requirement that the employer comply with applicable laws or guidance on notification of potential exposure, verbal review of the infectious disease standard, employer policies and employee rights under the HERO Act with employees, and anti-retaliation protections. These are all things that must be in these new airborne disease exposure prevention plans. And if you have been involved in dealing with COVID compliance for your company in the past year or so, you will recognize that all of these things have been in the COVID-19 specific reopening guidance. So that clearly is where these components are coming from. So again, like I said, the law says nothing about coronavirus or COVID-19, but it clearly picks up on what the state did for COVID-19 and said, okay, these are all the things that we want you to have a preventative plan in place to protect against, or at least be prepared for, future airborne infectious disease outbreaks. It will be somewhat interesting to see what the state does on this, because I think the biggest vulnerability with the concept is that everything that came out from COVID-19, to the extent the science was available or became available, was based on COVID-19. That is not any sort of guarantee that all future airborne infectious diseases would have the same properties as COVID-19, such that is 6-foot distancing what's important for the next disease outbreak, or does it need to be more or less? Are the masks that we've been using for the last year or so just as effective against some future disease? Nobody knows at this point, probably. So I suspect what you will see are standards largely based on the COVID-19 experience, although directed at some generic concept of airborne infectious diseases, which will probably mean that no matter what plan you have in place, there's always going to be the potential heavy reliance on the compliance with applicable laws or guidance types of language, meaning that it's great that you have this plan in place, but if we actually get to another public health emergency involving an airborne infectious disease, you will probably have to change your plans, policies, and procedures based on whatever the government is telling us at that time is important for that specific disease.